Hi, I'm Kelly, back with North Shore Eye Care, and I'm sitting with Dr. Martin right now. He's going to talk to us a little bit about LASIK. People always ask, does LASIK hurt? So how would you answer them?
LASIK doesn't hurt. So there are, well, when it comes to laser vision correction, there are two ways to do laser vision correction. There's LASIK, and in LASIK we make a flap, all laser, no blades, and then we do a custom correction. Custom correction means your fingerprint is unique to you, so is your visual system. So the laser gets a custom fingerprint of your vision. As we're lasering, it automatically centers, automatically tracks, even uses your iris landmarks to line it up. So the technology is great. And then there's surface ablation, also called PRK, or LASEK with an E. And what that is, it's the same vision correction, no flap. So you're just removing the skin layer, lasering, and then the skin layer goes back over. The difference between the two, everyone wants LASIK, because in a day you're back at work, you're feeling better, it's great. But maybe 20% of patients need to have the surface type for some kind of eye issue, such as thin corneas or regular corneas, dry eye, whatever the case. We go over that. So does it hurt? The procedure itself doesn't hurt. You will feel some sensations. The whole thing takes about 10 minutes. And the sensations you feel are pressure. You might feel some movement, some vibration, but not pain. And remember, we've been doing this for 20 years. I've been doing LASIK. You know, in our practice, we do over 100 a month for years and years and years. And everybody gets through the procedure. So I tell every patient that's very nervous, and many are, and I understand why they're nervous. But I tell them, I've never had to stop a procedure. And believe me, I tell every patient that you won't be the worst and you won't be the best. So that's how it goes. Now, and LASIK, the next day, you're really back in business. So LASIK is wonderful. With PRK, or the surface one, the healing takes about a week. So during those 5 days after surgery, you can have burning and tearing. It's more uncomfortable with the surface type. But the procedure itself is not painful.
Right. You brought up LASEK with an E. People sometimes ask, is PRK and LASIK the same procedure, different procedure? You know, is there any difference to it?
That's a great question. And LASEK with an E, in my opinion, was brought about just to confuse the public.
Okay.
So it's not LASIK. LASIK with an E means there's no flap. You're just removing the skin layer of the eye, lasering, and then the skin layer, you put it back on, but it's no longer vital tissue, so it just slops off. So in my opinion, PRK and LASIK with an E are the exact same thing, and neither of those are LASIK.
Okay.
And most people, or all of the centers that are going that are LASIK only with an E, just aren't, they just don't have intralays that makes the flaps that we make today in LASIK. But across the country, the overwhelming majority of laser vision correction surgeons do a majority of LASIK with an eye. So when you look across the country, across the world, when it comes to laser vision correction, LASIK is probably the 80% leader in vision correction procedures, versus the surface one, which is done more in situations where it's not advantageous to do LASIK.
Okay. Patients frequently ask about monovision. Could you discuss that a little bit and who that's an option for and why people would do it?
Sure. So monovision means essentially we're two-eyed animals. So in order to see three-dimensional vision, where the car is in front of you, where the stair is, where the curve is, you need both eyes. That's how you have depth. People that have one eye don't have depth perception. Now, that doesn't mean people with one eye can't drive or work or have great lives, because you use other cues like shadows and lighting to figure out distance. But what monovision is, you take one eye and you make it for distance. You take the other eye and you make it to read, and you keep both eyes open, and it's a way of cheating Mother Nature. So I'm 46. I have two distance eyes. I need help for reading all the time. It's a pain in the neck. But that's the way it is. But with monovision, what you do is you make one eye distance dominant, the other near dominant, and together you're able to make it through. In my experience, monovision is not an option for everybody. It is a good option for people that really don't want to wear glasses. So if you hate glasses and that's your most important thing, monovision works pretty well. And we know in LASIK patients that use monovision in contacts and like it, they'll love monovision in LASIK. But people that their biggest interest is to see the clearest and the best they can are more both eyes distance type patients, like myself.
Right.
I'm way too, I don't know what a good word for it is, but I'm way too particular to be able to accept monovision myself. I couldn't. But I don't tell other people what to do, and some people are very happy with monovision. But when it comes to monovision and LASIK, it's a discussion that needs to be had, a thorough discussion. And I discuss all your options on a complimentary
Like
consultation.
trying out contact lenses
We
for
can do
it.
that, or sometimes it's just a conversation about what it would be like that helps patients to decide that.